Imagine paying thousands of dollars for a medical procedure, right? And it boasts this massive 95% satisfaction rate in its first month.
Right, which sounds incredible on paper.
Exactly. It sounds like a miracle. But then you find out that just 2 years later, that satisfaction rate plummets to like 2%.
Yeah, it's a staggering drop-off.
It really is. So today for you, our resident learner, we are taking a deep dive into the booming industry of vaginal rejuvenation. Because, I mean, if you've sat in a gynecologist's waiting room lately or, scrolled through your wellness feeds, you've definitely seen the glossy marketing brochures for this.
Oh, they are everywhere.
Yeah.
And that term rejuvenation is, well, it's basically a master class in marketing.
Right. It sounds like a spa treatment.
Exactly. It implies this sort of turning back the clock, wrapping a really complex medical procedure in the language of a facial. But behind that spa-like marketing, we are talking about a serious medical intervention, one that physically alters human tissue.
Which is exactly why we're cutting right through those glossy brochures today. Our mission for this deep dive is to answer one very specific, very important question using, actual medical guidelines, clinical trials, and systematic reviews.
Right, looking at the actual data.
Yes. We want to know, what is the actual success rate of laser vaginal tightening procedures?
And my goal today is to decode that medical literature for you, the good, the bad, and the really murky stuff, without taking any sides. Because when you strip away the buzzwords, the physiological reality of what this laser does is fascinating. But it's far more complicated than a simple cosmetic touch-up.
Yeah, so let's start right there at the physiological reality, because before we can even evaluate if a procedure is successful, we kind of have to understand what success physically looks like at a cellular level, right?
Right, you have to know what the laser is actually doing.
Exactly. And I want to understand how firing a laser inside human tissue actually tightens it. When I was looking at the basic mechanics, my mind immediately went to dermatology. Like, is this procedure essentially like microneedling for the face?
That's a really good comparison, actually.
Or, to use a gardening metaphor, is it like aerating a lawn to get the grass to grow back thicker?
Aerating a lawn is a brilliant way to visualize it. I mean, whether we're talking about the face or the vaginal wall, the underlying medical principle is identical. It's called controlled thermal injury.
Controlled thermal injury. That sounds intense.
It is. You are deliberately damaging the tissue to trick the body into repairing itself.
Okay, help me picture that. What does this microscopic lawn aeration actually look like when it's happening?
So during the procedure, a specialized laser probe is inserted into the vagina. And there are two main types of lasers used in this space. One is a CO2 laser, which is ablative.
Ablative meaning what, exactly?
It means it actually vaporizes tiny columns of the surface tissue. It destroys it. The other type is an erbium YAG laser, which is non-ablative. So that one leaves the surface intact, but intensely heats the tissue underneath. Okay, so one vaporizes and one bakes? Basically, yeah. But in both cases, the device applies what we call fractionated laser energy. It doesn't just burn the whole surface, right? It creates this pixelated grid of microscopic heat damage.
Like little dots.
Exactly. It leaves healthy tissue in between those tiny damaged dots.
Okay, so those tiny dots of damage are the holes in our aerated lawn. How does the body respond to that sudden heat?
Well, that thermal injury immediately stimulates your local fibroblasts. Think of fibroblasts as like the tiny cellular factories in your body that manufacture structural proteins, specifically collagen and elastin.
Oh, okay. The stuff that keeps things tight and stretchy.
Right. So by creating this grid of injury, the laser forces those factories into overdrive. The body goes into repair mode, pumping out fresh collagen. And furthermore, this process causes the epithelium, which is the protective lining of the vaginal wall, to thicken.
Wow. And I read something about how this thickening process actually changes the bacteria in the area too, which sounds wild. How does a heat laser affect local bacteria?
It comes down to the life cycle of those cells. As those new, thicker epithelial cells regenerate and eventually shed, they release a complex sugar called glycogen.
Okay, glycogen. And why does that matter?
Because a normal, healthy vaginal microbiome relies on a specific bacteria called lactobacilli. The lactobacilli feed on that glycogen, and as a byproduct, they produce lactic acid.
Oh, and the lactic acid brings the pH levels back down to a healthy acidic state, which, prevents infections.
Exactly.
It sounds like you're essentially kickstarting an entire local ecosystem just by applying targeted heat.
You really are. And the standard protocol to achieve this is remarkably fast. I mean, it's an outpatient process taking only about 7 to 10 minutes.
That's crazy fast.
Yeah, and it's generally done without general anesthesia. Sometimes they just use a topical numbing cream. And typically, it requires 3 separate sessions spaced out about 4 to 6 weeks apart.
A 10-minute outpatient procedure sounds incredibly appealing, but going back to what we said at the start, a 95 or 96% satisfaction rate sounds almost too good to be true.
It does sound high.
Right. So when we talk about initial success, are these just like subjective patient surveys asking women how they feel? Or is there actual physical proof that the tissue is changing?
Oh, there's absolutely physical proof. The short-term clinical trials show overwhelmingly positive data. Across multiple studies, the percentage of patients reporting improvement, or just overall satisfaction, averages around 83.5%.
Wow, so over 80% on average.
Yeah. And depending on the study, that range sits anywhere from roughly 59% all the way up to that 96% mark we mentioned. Let's look at the Philippine study, for example.
Okay, what did that one show?
Well, this was a multi-center study involving 645 women, which, by the way, is a very robust sample size for this kind of research.
Yeah, that's a lot of patients. What happened with them?
Just 1 month after completing their 3 laser sessions, the researchers didn't just ask them how they felt. They measured objective clinical metrics. They used the Vaginal Health Index, or VHI.
Which measures what?
It's a clinical tool that measures elasticity, fluid volume, pH balance, and epithelial integrity, meaning, how robust and unbroken the lining is. They also use the Female Sexual Function Index.
And what were the results of those tests?
In the short term, immediately following the protocol, both of those physical metrics shot up dramatically. We saw drastic reductions in dryness, burning, itching, and dyspareunia.
Dyspareunia, that's the medical term for severe pain during intercourse, right?
Yeah.
Okay, let's unpack this. Because physically, the tissue looks healthier under a microscope, the pH is balanced, and the patients report a vastly improved quality of life. If we stop the clock right there at week 4, it sounds like a total win.
It really does.
But if this is such a miracle cure, why did I see the numbers plunging so drastically in the longer-term data? Here's where it gets really interesting, because it seems like this success has a very strict expiration date.
Yeah, and that is the crucial caveat that is almost always missing from the marketing material. Our high initial satisfaction does not equal permanent physiological change.
Right. The grass doesn't stay thick forever.
No, it doesn't. When researchers follow these exact same women a year or 2 down the line, the data tells a very different story. We can look at a landmark study by Purali that tracked patient satisfaction over a 2-year period.
And this is where we see that massive drop-off I mentioned earlier.
Yes. So at 4 weeks post-treatment, satisfaction was a staggering 95%. But then it steadily, predictably falls.
How fast does it fall?
Well, at 6 months, it sits at 92%. At 12 months, it drops to 72%. By 18 months, it's 63%. And when you hit the 24-month mark, patient satisfaction plunges to just 25%.
Oh, wow. Just 25%. I mean, think about what that means for you as a patient. You've spent thousands of dollars out of pocket because insurance rarely covers this, right?
Almost never.
Right. You've endured the discomfort of 3 laser sessions and the recovery periods, and 24 months later, you're right back where you started. The symptoms have completely returned.
Exactly. And the Gambacciani study corroborates this beautifully. They found that 74% of patients felt the treatment was highly effective for 12 to 18 months.
Okay, so you get a year, maybe a year and a half of relief.
Right. But at the 2-year mark, only 2% of the patients were still satisfied.
2%.
Yeah. Strikingly, 84.9% of the patients in that study opted to have a repeat laser procedure within that 2-year window just to maintain the results.
So the aerated lawn goes completely dormant again, the cellular factory is shut down, and you have to fire up the laser all over again.
That's the reality of it.
I mean, if a procedure's results fade entirely, is it a success or just a temporary subscription model for symptom relief? Because that brings up something that I couldn't stop thinking about when reviewing the sources.
What's that?
Well, if the physical changes fade so quickly and the symptoms inevitably return, how much of that massive initial success, that 95% satisfaction, is a profound physical change from the laser, and how much of it might actually be a placebo effect?
This raises an important question, and it's actually one of the most hotly debated topics in urogynecology right now. The medical community calls it the placebo puzzle.
The placebo puzzle, I love that term.
Yeah. So to test this theory, researchers designed what are called sham-controlled trials.
A fake laser procedure. Wait, How do you even ethically conduct a fake laser treatment?
It's clever, actually. You bring the patient in, you insert the laser probe exactly as you normally would. The machine lights up and makes all the usual beeping noises, but the actual laser energy, the heat, is turned down to zero.
Oh, wow. So they think it's happening.
Exactly. The patient fully believes they're getting the treatment, but no thermal injury is actually occurring.
That is fascinating. The patient is experiencing the entire clinical ritual without the physical aeration. So what do the results show? Does the fake laser work?
The results are incredibly conflicting. One major trial, the Ruan-Fu study, showed that the active laser group definitively beat the sham group.
Okay, so the real laser won there.
Right. But other trials, specifically the Cruff and Quick studies, found something stunning. Both the real laser group and the fake sham group improved equally in their pain and dryness scores.
Wait, really? Equally?
Yes. There was no statistically significant difference between having your tissue vaporized and simply hearing a machine beep.
That is wild. Why would the placebo effect be so incredibly strong in this specific area of medicine? I mean, we're talking about severe physical pain during intercourse. You can't just imagine that away, can you?
Well, pain, especially genitourinary pain, is deeply tied to our nervous system and psychological state. When a patient who has been suffering for years finally takes action, pays for a high-end treatment, and feels they are being proactively cared for by a specialist, their anxiety drops.
Oh, I see. So the mental relief translates to physical relief.
Exactly. That reduction in anxiety can actually relax the pelvic floor muscles and alter pain perception pathways in the brain. The brain essentially turns down the volume on the pain signals simply because it believes healing is happening.
So if this is essentially an expensive placebo for a significant portion of women, we have to ask, what is the alternative? If we're trying to measure success, we have to compare the shiny new laser to the traditional medical standard.
Right, you have to benchmark it against what we already know works.
Yeah, so what happens if they just use the standard medical treatment? What is the standard?
For genitourinary symptoms, the absolute gold standard has always been topical estrogen cream.
Just a cream.
Just a cream. Estrogen cream binds directly to the receptors in the vaginal tissue. It naturally thickens the epithelium, increases moisture, and restores the pH balance. All without any lasers, thermal injury, or thousands of dollars in out-of-pocket costs.
Okay, so we have the expensive laser on one side and the inexpensive estrogen cream on the other. Did any of the studies pit them head to head?
Yes, they did. We have a massive systematic review by Lai, which pooled data from 2,678 participants, alongside a major randomized controlled trial known as the VEL-AGIET trial.
And who won?
Well, both of these massive data sets found absolutely no significant difference in symptom improvement between using the laser and just using estrogen cream.
No difference at all.
At the 6-month mark, the physical relief and the structural tissue improvements provided by the laser were essentially identical to the relief provided by the topical hormone.
Wait, if the laser and the cream do the exact same thing, did any of the data look at what happens if you just do both? Like laser and cream together?
They did. The Cruise study actually tested that exact combination, and they found that the absolute highest success rates didn't come from the laser alone or the estrogen alone, but from combining them.
Which kind of makes complete physiological sense, right?
It does. You create the thermal injury to aggressively stimulate blood flow and awaken those collagen factories, and then you immediately provide the exact hormone the tissue needs to rebuild itself effectively.
A 1-2 punch.
Exactly. But it also highlights that the laser isn't a magic bullet on its own.
Right. And if the success rate of the laser is identical to standard estrogen cream, but the laser costs thousands of dollars and requires endless maintenance sessions, we really need to talk about the risks.
Safety is a huge factor here.
Definitely. We've been using this clean, highly clinical term-controlled thermal injury. But what happens when the heat isn't so controlled? How exactly does a laser go wrong inside the body?
It comes down to the fragility of the tissue we are dealing with. Women seeking this treatment often already have very thin, atrophied vaginal walls due to a lack of estrogen.
Because that's why they're having symptoms in the first place.
Right. So when you apply that fractionated laser energy, that pixelated grid of heat, it is supposed to penetrate just deep enough to stimulate the fibroblasts. But if the heat goes too deep, or if the tissue is thinner than the clinician realized, the body doesn't regenerate.
What does it do instead?
Instead, the thermal injury causes the tissue to fibrose.
Fibrous meaning it turns into rigid scar tissue instead of healthy elastic tissue.
Exactly. And that is where the regulatory bodies have stepped in. In 2018, the FDA issued an explicit, stark warning regarding these devices.
What did the warning say?
They stated clearly that safety and effectiveness have not been established for vaginal rejuvenation. They warned of serious risks, including severe burns, permanent scarring, and chronic debilitating pain.
Wow. And, the Gordon study from our sources detailed a case study that really brought that FDA warning to life in a terrifying way.
Yeah, that was a tough one to read.
It was a 65-year-old woman, a breast cancer survivor, who went in for the standard 3 laser treatments to deal with severe vaginal dryness.
Right. And a few weeks after her final session, she assumed she was healed and resumed intercourse. But she immediately experienced heavy vaginal bleeding.
Which shouldn't happen.
No. When doctors examined her under anesthesia in the operating room, they found severe, deep lacerations in the vaginal wall caused by the lack of elasticity.
But the horrifying part is that it didn't stop there. Months later, she presented with severe, unmanageable pain.
Because of the scarring.
Exactly. The thermal injury had healed so poorly and fibrosed so aggressively that her vaginal canal had foreshortened to just 2.5 centimeters. It was completely filled with rigid, scarred tissue.
It's a devastating complication.
Yeah.
Now, proponents of the laser will argue that adverse events are rare, and large surveys of practitioners do claim complication rates are around a fraction of a percent.
But still.
Right. But when things go wrong with thermal energy in thin tissue, they go catastrophically wrong.
Which completely explains why the major medical authorities are pulling the emergency brake on this entire industry.
Absolutely. Right now, major medical bodies, including NICE in the UK, the American College of Obstetricians and Gynecologists, and the International Urogynecological Association, have all issued statements with the exact same bottom line.
Which is?
They state these devices should only be used in strict, monitored research settings until robust, long-term safety data is actually available. They are telling clinicians across the board, do not offer this as a standard routine treatment for the general public yet.
Okay, so if the medical bodies are saying to stop, and the FDA is issuing warnings, and the results inevitably fade in a year or two anyway, why are researchers still aggressively studying this?
It's a fair question.
Like, why not just abandon the lasers entirely, prescribe estrogen cream to everyone, and be done with it?
If we connect this to the bigger picture, the reason they are still studying it is because, for one very specific, very vulnerable group of patients, estrogen cream simply isn't an option.
Oh, right.
For this specific group of listeners, this laser technology isn't a cosmetic luxury or a spa treatment. It represents a vital lifeline. We are talking about breast cancer survivors.
Help me understand the biological mechanics there. I know breast cancer treatments cause menopause, but why is it so severe that they can't even use a topical cream?
Well, many breast cancers are hormone receptor positive. That means estrogen actually acts as a fertilizer for the cancer cells, feeding the tumor and helping it grow.
Okay, so you have to eliminate estrogen to stop the cancer.
Right. To stop the cancer, oncologists prescribe drugs called aromatase inhibitors. If natural menopause is, say, a slow leak in a pipe, aromatase inhibitors essentially act as a giant wrench that forcefully turns off the body's estrogen faucet completely.
Oh, wow.
Yeah, they intentionally starve the entire body of estrogen to prevent the cancer from returning.
And because the faucet is completely turned off, the vaginal tissue degrades and thins out incredibly fast. I read that up to 70% of breast cancer survivors suffer from this severe urogenital atrophy.
It's a huge number. And this is the tragedy of their situation. You cannot just give them the gold standard estrogen cream.
Even locally?
Even locally. There is a terrifying theoretical risk that even a microscopic drop of absorbed estrogen could act as fertilizer and awaken occult, dormant cancer cells in the body. Both the oncologists and the patients are understandably terrified to use any hormonal treatments whatsoever.
So these survivors are left completely stranded. I mean, they're suffering from severe daily pain, extreme dryness, and a total loss of intimacy with absolutely zero conventional treatment options available to them.
Exactly. And for that specific population, the laser represents hope.
Because it's totally hormone-free.
Yes. Even if the laser only provides 12 to 18 months of relief, and even if they have to go back and repeat the procedure every 2 years, getting a year and a half of pain-free life back is an incredible life-changing medical success.
For a group that has essentially been told they just have to live with debilitating pain as the price of surviving cancer, a non-hormonal option is everything. Is the clinical data showing that the laser actually works well for them?
It is, and the research is showing that clinicians can modify the protocol to maximize that success for them. For example, the Athanasius study looked specifically at this high-need survivor group.
What did they find?
They found that because their tissue was so profoundly deprived of estrogen, the standard 3-session protocol wasn't always enough to awaken those cellular factories,
I needed more aerating.
basically. But when they bumped the treatment up to 5 sessions, the success rate skyrocketed. Vaginal dryness completely resolved in 86% of those patients,
Wow.
and dysphagia and painful sex resolved in 81%.
Resolving severe pain in 81% of patients who have no other options is a phenomenal clinical outcome. It highlights exactly why this technology cannot be entirely dismissed, despite the marketing hype, the high costs, and the regulatory red flags.
It really is a nuanced reality. The laser isn't a miracle cure for the general public, but it is a crucial, vital research frontier for those who truly need it.
So what does this all mean? Let's distill this journey for you, our learner. We set out to answer what the actual success rate of laser vaginal tighten procedures is. And the most honest answer we can give based on the clinical data is, it is highly dependent on when you ask.
Exactly. If you ask at 4 weeks post-procedure, it is a massive success. You are looking at an 80 to 95% satisfaction rate with measurable improvements in tissue health and pH balance.
But if you ask at 24 months, it is a steep drop-off, plummeting down to about 25% satisfaction. It's a temporary procedure that requires expensive maintenance.
And it carries potential severe risks of thermal burns and fibrotic scarring.
And ultimately, for the general population, it matches but does not beat the much cheaper, much safer gold standard of topical estrogen cream.
Making it, as of right now, a tool that should be heavily scrutinized by the average patient, but fiercely researched for breast cancer survivors.
Which leaves us with a really fascinating reality. When we started, we talked about those glossy marketing brochures promising to rejuvenate and turn back the clock with lasers. But looking at the clinical data, I want to leave you with a final philosophical question to ponder.
Oh, this is a good one.
If our primary medical responses to the completely normal, age-related decline in human tissue are either prescribing lifelong hormonal applications or firing literal fractionated lasers inside the body to aggressively trigger scar tissue, are we actually successfully treating a medical condition? Or are we just aggressively trying to technologically manage the natural evolution of the human body?
It is a profound question, and one that every patient should weigh carefully before sitting in that waiting room.
Thanks for joining us on this deep dive. Keep questioning the glossy brochures and keep learning.